for change. But driver no send because that change got sweet. E get one important corner kick. Your hair don't almost ready. Now im barber stop work because your hair fit wait. Go won't enter for inside last minute.
Yes, sir. Everything fit wait. The FIFA World Cup 2026 don't show from June 11 to July 19. Catch all 104 matches plus pidgin commentary on top 4 correct channels. Demo. Touchlight the FIFA World Cup live on Super Sport from as low as 5,800 naira per month on GoTV. GoTV. Love it.
A wannan kasar tamu ta Najeriya, kowa sai ya samu rabansa, mace ko namiji har da yara ma. Kowa zai yagi rabansa cikin wannan garabasan close up 130 gram red hot. Za ku iya samun naku kasan daga cikin kyaututtukar miliyan 500 da aka ware, wanda ya kunshi kyautar lokacin magana, biyan kuɗin wutar lantarki, tsabar kuɗi da kuma liyafa da masoyi ko masoyiyaku. Kawai sai close up 130 gram red hot ku bude, ku tura lambar code da ke ciki zuwa ga *8011*5# sannan ku bi matakan, ku hanzarta lokacin karban garabasan ya iso, ku gaya makwabtanku, abokai da kawayenku, kai har ma da tsofin masoyanku. A shelanta kowa da kowa zai samu. A sa'ilin da kuke siyan close up red hot 130 gram, zuciyarku za ta raya muku samun wani babban rabo. Wannan tallan zai fara daga watan Afrilu zuwa watan Yuli shekara ta 2026.
Mama, sai kin gan yadda na wanke ban ɗakin nan, yawon ku sosai fa.
Tabbas zai iya wankuwa sosai a ido, amma idan ba da hypo toilet cleaner kika yi amfani ba wajen kariya, to ban ɗaki cike yake da ƙwayoyin cuta baja-baja.
Haka ne, gara ku yarje wa ƙwayoyin cuta, ku kare ban ɗakin ku kullum da hypo toilet cleaner.
Mu tuna yadda mama take sammakon tashi da wuri ta shirya mana karin kumallo.
Lallai kuwa, ya kamata mu mata wani abu muhimmi.
Kyautata wa mahaifiyarka tare da biya mata kuɗin tafiya zuwa birnin Zanzibar a wannan shekarar 2026 a gasar 3 Crowns Mom of the Year. Ka rubuta bayani ta amfani da kowace harafi na sunanta. Ka aika tare da hotunan hajojin 3 Crowns na akalla naira 5,000 zuwa www.3crown.com.ng ko cibiyoyin karban bayanai domin samun damar cin nasara a gasar. Akwai shirya da ka'idoji. Madarin 3 Crowns, lafiyar iyaye mata, farin cikin iyali.
Ji daɗin abincin onga don babban dandano da ƙamshi.
Sallah ta gabato, shagungula sun kankama.
More bikin sallar ka da samun garaɓasa daga kamfanin Itel.
Samu samfurin wayar salula ta Itel City 200 akan farashin 139,900.
Har ila yau zaka samu Itel A200 Plus akan farashin 129,900 tare da samun sauƙin 5,000 a kowane siye.
Garaɓasar za ta fara ne daga 15 ga watan Mayu zuwa 15 ga watan Yuni. Gaggauta domin samun naka. Itel more rayuwa ta jin daɗi.
Is that Alfie playing football in the rain?
It's Toby Chio.
My goodness. When did he grow up? That's it with kids, though.
It's amazing how your child grows up before your eyes. Enable their thriving development with the new NanKid 4 with HMOs to support your child's development, probiotics, and high-quality proteins to support age-appropriate growth. NanKid 4. Nourish your child's potential.
Jolly Johnny akan titi ke magana. A yau za mu ga kyakkyawar sani da mutane suka yi wa Maggi cikin flavor. Na gaba, karanto harufan celery.
S-E-A-L-A-R-R-I-E. Celery.
Haba mutumina, ka ce kawai ka sauya harufan zuwa salary. To ga damar ƙarshe, karanto mana harufan turmeric.
T-U-R-M-E-R-I-C. Turmeric.
Kin yi daidai, ga kwali ɗaya na Maggi cikin flavor ki ɗauka.
Maggi cikin flavor tare da albasa, celery da kuma turmeric mai canza wasa na.
Follow all the action as all the whole Football League they end. Who go win the title for Premier League, La Liga and Serie A live only for Super Sport on Top GoTV. Reconnect today. GoTV. Love it.
Invicta 98.9 FM.
Your Health 360, only on Invicta 98.9 FM with Jacquelyne Adebija.
All right. Good evening, everyone. And I really need to apologize for coming at this time. I had to wait for my guest, but I'm glad to say he is here this evening. With me in the studio is Dr. ABDULLAHI YAHAYA. Doctor, it's great to have you. Thank you for making out time. We know that people like you are always busy with one thing or the other, but thank you for coming in. Thank you. All right, so let's just jump straight into it because we really do not have much time anymore. Pregnancy is a time when women are happy. You know, you're bringing new life into the world. It's awe-inspiring. It is something that every woman that at least likes that kind of life aims for, hopes for, and yet there are many conditions that make that time a very delicate one. And one of those conditions is what we're talking about today, which is pre-eclampsia. What is pre-eclampsia?
All right. Thank you for having me. I'm sorry for coming in late. Just to pass the information, today is May 22nd, is a World Pre-Eclampsia Day.
Indeed.
And that's why we are also utilizing this opportunity to make sensitizations and awareness on the condition. So pre-eclampsia is a hypertensive disorder that occurs in pregnancy. There are a lot of hypertensive disorders that do occur in pregnancy. And for us to understand pre-eclampsia, I think I need to set some background. Usually, hypertension is when the blood pressure is greater than 140/90 millimeters of mercury. So for pregnant women, the hypertensive disorders are classified into first gestational hypertension. The hypertension that occurs in a woman that previously has normal blood pressure, but by virtue of being a pregnant woman, she has she developed hypertension. Now this hypertension, usually for we to say it is gestational hypertension, a hypertension that occurs in pregnancy, it has to occur at a time greater than 20 weeks of gestation. So that time we will associate that hypertension with pregnancy. So that's why we call it gestational hypertension. And
that is when it's above 20 weeks.
When it occurs after 20 weeks
after
of gestation.
20. Okay.
So, and that hypertension too, we have to measure the blood pressure more than one time, like 2 times, and at least 4 hours apart. So that is gestational hypertension. Now, when you now have that gestational hypertension with protein in urine, and then after 6 weeks, just an addition to that gestational hypertension, first it has to occur in a woman that has normal blood pressure before getting pregnant, and even in pregnancy it has to occur after 20 weeks of gestation, and then her blood pressure comes back to normal within 6 weeks after delivery. So that is to tell you that hypertension is associated with the pregnancy. Now, when you have that above mentioned plus protein in urine, that is pre-eclampsia.
Why?
So what it means is that she has blood pressure, elevated blood pressure in pregnancy. That's after 20 weeks, which previously she has normal blood pressure and plus protein in her urine. And her blood pressure comes back to normal after delivery within that 6 weeks of her purpurian time. So that is pre-eclampsia.
Pre-eclampsia.
Yes.
What does so just so that we also know, like in months, 20 above 20 weeks would be above 5 months or thereabouts?
Yes, because we calculate in weeks. And for the first 3 months, that's first trimester, is usually 13 weeks. So second trimester, when you plus another 13, that's 26 weeks. So when within that second trimester, that is where
you're looking at
yes,
concerning
exactly.
pre-eclampsia.
And specifically 20 weeks.
Specifically 20
Yes.
weeks. Now, why that difference, Doc? Why, when you see protein in such a person's urine? I ask because many of us have come to realize that, if you see your pee foaming, that means that most likely you're losing. For us, the couch doctors, roadside doctors, you worry that you're losing protein or something like that, and that in itself is a pointer to diabetes. So I'm wondering, is diabetes in all of this or it's not?
Okay, it comes back to what are the things we are looking at that likely come up or bring about that pre-eclampsia. That protein, even the protein we are saying about, we have to check very well, and not just that protein. There's dipstick protein, and there's the one that we go and we check the other parameters too, just to be able to make sure that it is not the protein that we see in somebody that has urinary tract infection. It is not the protein that we see when somebody did not give us clean catch, or probably he has some discharge also. So it has to be a very clean catch urine to be sure that that is actually the protein we are associating with that pre-eclampsia. And there are other things that are associated with that. We have to check the significance of the protein in urine. It's not just I'm just saying +1 protein and this woman. No, there are other things too we should check. It is just like a primer. When you see something, you have to make sure you evaluate this woman fully to be able to know that yes, because yes, when we look at symptoms, sometimes they may not present with the symptoms of headache, epigastric pain, blurring visions. So we have to look at the protein first, and then we look at the clinical presentations.
I just
we look at the gestations of the woman.
Okay.
It's holistic.
I was just about to ask you one big English that you called just now, but we'll be right back after, when you were talking about the symptoms. So we'll be talking about the signs and symptoms after this short time on a commercial break. We'll be right back. Do stay with us. We're talking pre-eclampsia today on Your Health 360. We'll be right back.
Akwai abun da nake tunani, abubuwa za su canja. Hero ta yana gaban ka. Saya hero ta mashin. Yana da kyau. Hero ta mashin. Baya sa kashe kudi, baya shan mai. Hero ta mashin. Yana da gudu sosai. Hero ta mashin.
Samu damar ƙara tattala manka tare da adana kuɗaɗenka tare da sabbin nau'ikan Hero Hunter Kickstart Alloy da aka sabunta. Yanzu ana samun su a gurin dillalai mafi kusa da ku. Ƙarin tazarar tafiya, sauƙin kashe kuɗi. Domin ƙarin bayani sai a tuntuɓi 0800 080 080 800.
Across Nigeria, MTN Foundation has impacted 600 plus communities with the What Can We Do Together initiative, inspiring a world where no community is left behind with better healthcare and science lab facilities. Nominate a primary healthcare center and a public secondary school for upgrade today. Visit www.mtn.ng/WCWDT or text MTN to 421. Nominations close June 8, 2026.
Follow all the action as all the whole football league they end. Who go win the title for Premier League, La Liga and Serie A live only for Super Sport on Top Go TV. Reconnect today. Go TV. Love it.
Sallah ta gabato, shagungula sun kankama.
More bikin sallar ka da samun garabasa daga kamfanin Itel.
Samu samfurin wayar salula ta Itel City 200 akan farashin 139,900.
Har ila yau zaka samu Itel A200 Plus akan farashin 129,900 tare da samun saukin 5,000 a kowane siye.
Garabasar za ta fara ne daga 15 ga watan Mayu zuwa 15 ga watan Yuni. Gaggauta domin samun naka. Itel more rayuwa ta jin daɗi.
no be one, no be two, he plenty. This not true. With Cocoa Glow, your skin they glow. Even tone, your shine they show. Aloe Soothe for soft skin, dry skin repair, no dryness. Med extra hydration for strong moisture. Advanced repair, skin good as new. This is how we do.
Vaseline lotions, enriched with extracts, oils, and moisturizing glycerin. Choose the lotion that gets you.
Oh, yeah, choose your own. Make your skin in the show. Vaseline lotions for you. Ooh, yeah, 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 yeah.
Emeka, I'm in trouble. The way the cost of everything is rising, I can't find a way to get these goods to my clients in Kano and Jos without losing my profit.
Musa, why are you doing this the hard way? You need a partner that understands the rising cost of getting by.
You mean someone who actually shows up?
Yes, I mean Prashal Express. I use them for everything. Packages, sensitive documents, even home deliveries. They are professional and they don't break the bank.
Do they go nationwide?
Nationwide? Lagos, Benin, Makurdi, you name it. Just give them a call. Big parcel, small package, value-add services like home delivery, Prashal Express and Logistics Limited is the one company for total reliability. Whether you're too busy to leave the office or worried about the rising cost, we are here for you.
Prashal Express, we deliver for you. Be rest assured, we are coming through. Find our main office at Shop FF18, Starcourt Shopping Plaza, Sabantisha, or our branch office at S20, Zara House, Amadou Bello Way, Kaduna. They've already picked up the goods. That was fast. You can call us on 0706-210-6674 or 0913-775-4873. Prashal Express and Logistics. Be rest assured.
A koda yaushe yara na suna kokarin koyon karatu. Guje-guje cikin wasa na rage musu kuzari. Yasa kullum bana rabuwa da Milo a gida.
Ni da mai gidana mun dace da zaɓi mai kyau. Ina godiya da farin ciki kasancewar Milo an yi shi daga sinadari masu inganci kamar su dawa, madara da koko. Shi yasa na tabbatar da yadda yake inganta lafiyar yarana tare da basu kuzari da safe.
Kowace rana is the one rana ta ɗaya for you to give 100 ji daɗin tracks ɗinka. 100 ba tare da saurarawa ba, 100 da kuzarinka. Tare da gang ɗinka a dance floor. An kasance a cikin shiri because you are ready to go again. Domin kai ɗin dai ne, you don't need permission domin rayuwa ta zahiri, rayuwa mai inganci, rayuwa mai cike da 'yanci because you owned it all. Leave it 100 MTN.
Mai gida, zo ka ji yadda jaririn ke motsi a cikina.
In ji? Lallai, da alama wannan na da ƙarfi sosai.
Mana, da wa kake gani zai yi kama?
Da ni mana.
A'a, da ni wannan zai yi kama.
To wanda zai zo bayan wannan zai yi kama da ke.
Tabɗi, to har yaushe zan jira wancan ya zo?
Kamar shekara 2 haka.
Kaga a lokacin na samu ƙwarin jiki.
Tattaunawa tsakanin ma'aurata yana da muhimmanci. Mu tattauna.
It's amazing how your child grows up before your eyes. Enable their thriving development and the care they need with the new NanKid 4 with HMOs to support your child's development, probiotics to help your child's digestion and development, and high-quality proteins to support age-appropriate growth. And all of these work together to support your child's development and growth today and tomorrow. NanKid 4. Nourish your child's potential.
Oh yeah now. Time to run your money correct. Download Bill Station for iPhone and Android, no dolly, no. Or waka go to billstation.com, sharp. Bills, transfer, everything day one place.
Make you get rewarded instanta when you use the referral code BISAN. BISAN. When you download the Bill Station app, make you enjoy exclusive bonuses plus cash prizes wey fit reach up to 5K. No dolly, make you download now.
Bill Station, money no go stress you again.
My friend, time na money.
Wani abin haushi ya rikide ya zama abin burgewa a gare ni. Sai gumin da yake kaiwa da kawowa cewa ina nake samun kuɗin da nake shiga shagunan sayar da kayan gyaran fata da inganta lafiya. Ya tsamani jikina baya nuna shekaruna, babu alamun gajiyawa a jikina. Gashi kullum a cikin kumari da ƙoshin lafiya nake. Tsarin bada tazara shine babban shagona. Bada tazarar haihuwa ya taimake ni wajen inganta lafiya da kumarina. Bada tazarar haihuwa ya kyautata halittata, ya inganta halittar jikina akan shekaruna. Tsarin bada tazara yana sa jikin iyaye mata ya huta daga ɗawainiyar haihuwa da shayarwa, wanda hakan yake sa uwa ta watsake cikin ƙoshin lafiya.
Tsarin bada tazarar haihuwa yana inganta lafiyar mata tare da ba su damar murmurewa sosai.
Ziyarci cibiyar lafiya mafi kusa domin farawa ko a kira lambar waya 222 wannan sako ne daga ma'aikatar lafiya tare da tallafin gamayyar kungiyoyin Pronet da FEM.
Kyautuwar iyali uba 'ya'ya da ma'uwa.
Ki huta mama, yanzu na zan wanke maki fararen kayan nan naki.
To, amma ba wanke su kawai zaki ba. Ki tabbatar kin yi amfani da haifo domin yana cire duk wani takaddarin tabo yana kuma sa fararen kayana su ƙara haske kalkal.
Haka ne, kada ku amince da tabo, ku tabbatar farinku ya ƙara haske kalkal.
Jolly Johnny akan titi ke magana a yau za mu ga kyakkyawar sani da mutane suka yi wa magi cikin flavor. Na gaba karanto harufan celery.
S-E-A-L-A-R-R-I-E celery.
Haba mutumina, ka ce kawai ka sauya harufan zuwa salary. To ga damar karshe karanto mana harufan turmeric.
T-U-R-M-E-R-I-C. Turmeric.
Kin yi daidai, ga kwali ɗaya na magi cikin flavor ki ɗauka.
Magi cikin flavor tare da albasa, celery da kuma turmeric mai canza wasa na.
All right, welcome back from that commercial break. Still with Dr. ABDULLAHI YAHAYA. And we're talking pre-eclampsia because today is World Pre-eclampsia Day. And he's talked to us about what it really is. And now we want to quickly hear what are the signs and symptoms. You talked about, I know you said headache, and then you called one thing, whether you said epigastric. All right, go ahead, Doc.
All right. So just like I mentioned, sometimes it will be asymptomatic, like there's no symptoms. And just when a woman comes to antenatal, you just find out that her BP is high, and then at some time she will get protein in urine. And sometimes for, like I was classifying the hypertensive disorders I mentioned, because a woman that was also having chronic hypertension too before she becomes pregnant can also have chronic hypertension with superimposed pre-eclampsia. She can also develop pre-eclampsia. It's not that I doesn't have blood pressure. I can develop pre-eclampsia. Even if you have a blood pressure, you can have a superimposed pre-eclampsia. And it's worthy to note that pre-eclampsia can develop to eclampsia, which women will convulse. We'll have to rule out other causes of convulsion just to know that also this is eclampsia. So this blood pressure, like I mentioned, part of the features I'm about to see, there are severe features of the pre-eclampsia. Yes, the blood pressure can be greater than 40. So when it's within 40 to 160, yes, it's a mild hypertensive. But greater than 160, that hypertension, you will find out that in clinical practice, you will see a woman will come with BP of 200 plus, over 100 plus, you get. So there are severe features. So from coming to now the clinical sign that women will now, the symptoms they do complaints with, like I mentioned, headache, they will have blurry vision, they will have dizziness. That epigastric, as I mentioned, it's chest pain. Epigastric region is this middle of the chest.
Middle of the chest,
yes, so
there.
they will be having some that
somewhere under the breast,
under
right?
the breast, just
Okay.
within. So they will be having that pain also. Though body swelling, usually women do have swellings in their especially leg swellings, but at some point it becomes too significant in those, especially involving the whole part of their body. That too are symptoms that women do come in. In fact, some will have difficulty in breathing because they have that fluid, that edema has also gotten into their lungs too. They will be having difficulties in breathing, and these are some of the features. But in addition to those signs, symptoms that I mentioned, there are other parameters that will also be able to know that this is preeclampsia, because we have to also check the biochemical profile of that individual. We'll check the even in the urine analysis that we do, we check other details of the urine, like for example the pH of the urine and other indicators within the urine analysis. We do full blood count because they usually comes with a lot of hematological disturbances, like the blood. They will have platelets may go low. The platelet, let me not disturb you with clinical terminologies, but we do check the blood levels to ascertain other parameters like kidney problems, kidney disease, long-standing hypertensive disorders like diabetes too. These are some of those that will predispose. If someone is having kidney problem, it's at risk of developing preeclampsia. When you have a
before pregnancy,
pregnancy,
now we're looking at predisposing
factors.
Okay,
so I'm trying to link it up to, because these are some of the things that we do investigate, to do electrolytes, because in preeclampsia their creatinine is higher, so we do check. But even that, those with already kidney problems to do have creatinine and urea elevated. But I'm just telling you some of those parameters because I wanted to expand here, because when you say protein in urine, so yes, that protein is just for us to have an idea this is preeclampsia. Then we investigate further. Like I mentioned, we do blood count, we even check the other urinalysis, not just the urine and the combi2 that they usually use and the antenatal, but there are other combined parameters that we do check, the leukocyte and amongst others. And then we also check the kidney functions of that individual. We check the liver because it affects also the liver. Yes, especially that liver, they may have that pain too. They will be having some liver engagement. And then apart from that, we do other blood investigations just in addition to full blood count, because they are at risk of developing disseminated intravascular coagulopathy, because they may have ongoing hemolysis, like blood cells is hemolyzing. And then
what do you mean by hemolyzing?
It's lysing. The blood cells is like how would I call it in simple terms?
In layman's terms,
hemolysis
is getting like destroyed.
Destruction. Yes, it is getting destruction. So they will have that hemolysis. That's what we call HELP syndrome. They will have hemolysis. The liver enzymes will be elevated, and I mentioned that they have platelets. They are platelet. It's what used to help person to when you injure, it helps to mobilize, and then the
quickly heal that place up.
And so, but the platelet is slow, and that's why they are at risk of bleeding. Exactly. And one of the complications, they usually have abruptio placentas, and then that will also have ultimately affect the baby. And other complications is it, in addition to what is happening to the mother too, the baby, if it's an early onset preeclampsia, it may affect, like the one that does occur within the second trimester. It can affect the growth of the baby, and the baby will become will have growth restriction. It will not correspond to the gestational age, and they will have risks of neonatal intensive care unit admission following delivery. And most of what is most significant about it is that a pregnant woman, when delivered, as soon as the placenta is out, because it's called like a placental associated disorder, because most of the pathogenesis, what is comes into developing of the of the preeclampsia, even though it still have some, it's etiologically associated disease, but there are some pathological conditions associated with them. The generation of the spiral arteries, the endothelial dysfunctions. These are some of the terminologies I'm just, but it deals with the blood vessels, then the attachment of the placenta to the maternal
to the womb,
to the womb,
to the uterus,
exactly.
right.
So these abnormalities within that biochemical ongoing within that used to be attributed to that factor. So as soon as the woman is delivered, the placenta is out, the blood pressure will comes back to normal. So that is what is associated with that. And like you mentioned that, yes, diabetes, yes, those with diabetes are at risk. So in addition to other risk factors, a woman that had a preeclampsia, she's at risk of getting preeclampsia in another pregnancy, in subsequent pregnancies. So
Oh.
previous history of preeclampsia or family history of preeclampsia.
So people who have that history, what would you advise?
Yes, and that is when we come to prevention, they book early, before 20 weeks of gestation. They should book for antenatal. When they come for antenatal, we do give them some preventive medications that we do give, and that's why we advise that they book very early. We give vasoprins amongst other medications. They start to take their medications early, and then we monitor, because we know they already had a previous history, so we have to monitor them very well. We check the urine as early as possible, and then we monitor the urine as early as possible. But with those preventive therapies and then counseling, they do get better. When they know they have it and they counsel very well, they usually get to watch on the symptoms themselves, even the patients too. So that's why we advise that they come early. And then women who for elderly primigravidas, usually not even elderly, women that are, these their first pregnancies, and then those that are above the age of 35, and then those that have multiple pregnancies, these are found to be at risk of developing preeclampsia. Like I mentioned, those that have chronic kidney problems, liver problems, amongst diabetes, these are people at high risk of developing preeclampsia. It has been found that black race is associated with high incidence of preeclampsias. Yes, these few I mentioned the risk factors. So, but I mentioned that complications like it will affect the mother and the baby, and as I also mentioned that it leads to intensive care unit admissions, and the most important thing is to be diagnosed early, and the delivery is as soon as possible, especially if it is tilting towards eclampsia. But for a woman that we can be able to, because when they develop preeclampsia, the most important thing is to control the blood pressure, to prevent them from developing eclampsia, because they are at risk of that convulsion. And then after stabilizing the patient, deliver as soon as possible, especially if the baby is near term. And then for other if the baby is not near time, you look at the risks and the benefit, because sometimes if it's developed early, you look at it has to take some longer weeks for the woman to reach term, and if the preeclampsia is that severe, it's something that the obstetricians will need to also see, and then the facilities also, because preeclampsia management is a multidisciplinary. You have to involve the neonatologist in the management, because you just can't just deliver the woman. You have to make sure that when you deliver, the baby is going to be take care
in
of.
good hands.
Exactly. And they can develop some complications, like I mentioned, disseminated intravascular coagulopathies, bleeding disorders. So you have to involve also the hematologist, so that all those specialists can work together to be able to address the ongoing insult affecting the woman and the baby. And for the prevention, I mentioned they book early, and then they attend antenatal as early as possible, and then we monitor. So this is just a few about the features
of pre-eclampsia.
Pre-eclampsia.
Let's open up the phone lines. People might have questions. I'm glad your wife is okay. Usman Isa Bilal, I see your comment on our Facebook feed, and I'm glad your wife is okay. Victor Sule, good evening to you. All right, so let's go to the phone lines. You might have questions for the doctor. 081 40989. That first number is 081 40989. And then we have 070 87800 989. The last number is 070 87800 989. When I say call, I'll take it. But do women who suffer from preeclampsia, when managed well, can they actually have their babies on their own, or usually the best way would be to go through surgery to deliver their babies?
Okay. Usually, if it's an early onset, especially if it occurs in less than 34 weeks gestation, 34 weeks and below, the baby is not even fit enough to withstand the stress of labor and then to pass through the birth canal. So, and then, and I like that you asked that question, because it's not every woman that comes in with preeclampsia. The fact that delivery is the most important thing to do, as soon as you just stabilize the patient, you have to check at the condition of the woman and also the baby. Now, the condition of the woman, we have to be sure that this woman is fit enough. You keep preeclampsia aside. Yes, you want to deliver, but like any other woman, preterm delivery is always cesarean section, except if there are other things that will make it that the woman will have to give deliver vaginally, like for example if the baby is dead also, and then other factors that will now link it to. But the baby is alive and the baby is preterm, you go for cesarean section. Then if the baby is like it's a late onset preeclampsia, a woman is already term and she has all the parameters that we do check, because we have to assess the pelvis, that this pelvis is fit enough for the baby to come out. Because there are other, it's not just preeclampsia, like there are other indications why women should undergo cesarean section. And if that indication it's there in that particular woman, even if she is term,
even if she's fit, even if it's term,
if she's term, she will undergo that cesarean section. But if she is fit enough, we check the biophysical profile of the baby. It's very good for the baby to pass through the birth canal, and we assess the pelvis of the woman, and she met up with all the criteria. The cervix is good, you get it, and then the cervical length is good. We call it Bishop's score. It's a score that we assess the pelvis to how the baby can be able to come. If she has a very good Bishop score, yes, we can go in and induce labor. So that when we induce labor, but we have to prepare, because we are running against time. We have to deliver those women as soon as, we call it the safest and the fastest route. Now, based on the logistics within the facility, if the safest and the fastest route is cesarean section, you just opt in. You don't even waste your time. If the safest and the fastest route, you believe that yes, you can achieve, because some women can come in, can be diagnosed with preeclampsia in labor.
Wow.
She's already dilating, and you already 5 centimeters, 6 centimeters, you find out that yes, she has, and you begin to institute all those, you control hypertension, prevent her from going to eclampsia, and while you are still preparing for it, you expedite the delivery and she will deliver. You see, that one is the fastest route for her.
Right.
For a woman that comes in, she is not in labor, and that woman is not fit enough to even go for cesarean section. You look at it, what is the best route for her, because sometimes you may begin to induce the woman and in the end it will fail. You will not wait, you want to say you want to try again, or you want to use another mode of the induction, so you want to go. But if she is stabilized, baby is fine, and you still have the time, you believe me, because sometimes there are some conditions that you see that it can be managed, especially when you have good hands, the old professors that have seen it, and they know that yes, we can do this, we can do that, and things are going, especially the most multidisciplinary approach. Everyone is giving his own views on, okay, let's do this, let's do that, let's do it. Yes, it can, but the most important thing is to deliver safest and the fastest route.
If the woman has convulsed, for instance, at home, before they get her to the hospital, can there still be a good outcome if they bring her even in that condition?
Okay, that's eclampsia now. Eclampsia, when she already when she has pre-eclampsia and now had a convulsion, and we have to rule out that she doesn't have seizure disorders and other causes of convulsion to be sure that this woman is now. Yes, if she convulsed and they rushed her to the hospital, the most important thing is to deliver her as soon as possible. You institute all the management that we do, control the hypertension to be able to stabilize her.
What if she's not term?
Yes, she has already convulsed. And the management is that placenta, as much as that placenta is still in that womb, that woman, even if you stabilize, you just give it some time, that thing is still there.
It's going to come back.
It's going to come back. So that's why the moment you stabilize, you terminate the pregnancies. You get it? Because it's not, you look at the chances for the woman and also for the baby, especially babies that are far from term. You get it? Those that are near term, yes, you try as much as possible to deliver, either through cesarean section or through, and then you take the baby to intensive care unit for them to have proper care. While you take the woman too, for those that have convulsed, you have to make sure that that facility has intensive care unit for the baby and for the mother, because she has convulsed, she's unconscious. And after the delivery, you now keep her at the intensive care unit to be monitoring her. And it's about found that yes, women do come up and you see them very healthy.
Very healthy.
Yes.
Just quickly, we've run out of time, but you took me back to my childhood where this lady had a baby and she was never the same mentally. And, you know, at that time they said blood went to her head. That is the terminology in my language, like blood went to the head. So I'm just wondering, was it a case of eclampsia? Was it pre-eclampsia that was poorly managed? And does it really, I mean, if one is lucky enough to go all into eclampsia and come out, does it really affect those mothers mentally?
You see that, you know, like we are mentioning, people are working with a lot of illnesses and disease. Like, you can have a pre-eclampsia or eclampsia with coinciding or with an existing another medical condition, which can worsen the condition. So that we can't really see, but it has been found out that yes, women do recover fully, especially if they get the right care and they meet the right people and at the right time too. Because if you delay getting care, you know, all those delays, the primary, secondary, and if those delays are there, you see the complications may come in, and then somebody can have a long-term comorbidity. But for that particular story that you narrated, we can't really say. Only those that are there around that, but we can only give our own views. But she can have an existing illnesses that coincide with those conditions that triggers that, or she may even develop it from that particular time that she had those things.
I think it's important that you speak, you know, some final words to men, because you spoke about some signs and symptoms that I believe even when women, because women are notorious for brushing things off. Oh, you know, it's just a headache. Oh, you know, it's just this. It's just pains. It's just this. But what would you say to men who care for these women who are listening? Because it is obvious from all your explanation, doctor, that prevention, I mean, the minute you see some of these things, get these women to the hospital, because in this case, prevention is better than cure. So talk to them for us. Let them hear from you.
Let me also tell the men that, you know, part of the risk factors, a woman that is in her second order of marriage with another partner has a risk of also developing pre-eclampsia.
Oh, really?
Yes. So the most important thing as a man you ensure that as soon as the pregnancy is diagnosed, as early as that, make sure you bring in your woman to book for antenatal within the first trimester, so that all those parameters can be checked in, and then you support her in all those her visit. Ensure she is very timely in her visits. She takes her routine medications, and then I'm very sure our primary healthcare facilities and secondary healthcare facilities know the red lines, and the moment they picked it, they should be able to forward to the facilities that are well equipped to manage those conditions. So the men should be able to support their wives, and they should know that yes, preeclampsia is there, but if it's diagnosed early, both the mother and the baby can be taken care of. And they should know that the stress to those two, the mother and the baby, is a double stress to the husband too. So he has to do everything possible to support them and then to give them all the necessary care. And for those that have preeclampsia, already suffered from preeclampsia, they should, when in our facilities, when we discharge women, there's postnatal clinic. For those women that have had cesarean section or delivered spontaneous vaginally, we ask them to come for postnatal clinic for routine checkup. We monitor their blood pressures. Sometimes you get to find out that from that particular preeclampsia, they develop hypertension, chronic hypertension. So by then, we begin to monitor with them. And then if they develop chronic hypertension, you channel them to cardiologists and you co-manage with them. And then that postnatal care is important. After postnatal care, preconception care, those people who are planning to conceive,
still have
you
children.
come early, get preconception care early. In preconception care, you tend to get people that already have chronic hypertension. They are not yet pregnant and they already have some chronic hypertension. All other medical conditions, pre-existing medical condition or chronic medical condition that they do have. So there you have the record there. And then you begin, if they already have those risk factors, you highlight it and then you monitor when they get pregnant. And when they are pregnant, they book early. You should book early. If you already have a previous history of preeclampsia, we give you those preventive medications for you to be taking during your routinely with your routine antenatal medications. And then we routinely check you. We give you focused antenatal care because we know you are a high risk patient of developing another preeclampsia or even developing other conditions, because when you have hypertension in pregnancy or preeclampsia, your baby is also at risk because the placenta is not getting enough blood because of the vasoconstriction within the blood vessels. So that baby may be having some challenges. The baby may not grow the way it's not supposed to be. So this is it.
Thank you so much, Dr. Abdullahi. We really appreciate your coming this evening. Well, you've heard it. Preeclampsia is a very critical condition. Let's watch out for and support our wives during this critical period. Once again, Dr. Abdullahi Yahaya, thank you so much.
Thank you for having me.
Until next week, when we hope to come your way again, please remember that lessons must be taken from programs like this, especially if you have a pregnant woman around you. Until next Friday, watch out and support our pregnant women. Stay victorious.
Is that Alfie playing football in the rain?
It's Tobichio.
My goodness. When did he grow up?
That's it with kids, so. It's amazing how your child grows up before your eyes. Enable their thriving development with the new NanKid 4 with HMOs to support your child's development, probiotics, and high-quality proteins to support age-appropriate growth. NanKid 4. Nourish your child's potential.
Across Nigeria, MTN Foundation has impacted 600 plus communities with the What Can We Do Together initiative, inspiring a world where no community is left behind with better healthcare and science lab facilities. Nominate a primary healthcare center and a public secondary school for upgrade today. Visit www.mtn.ng/WCWDT or text MTN to 421. Nominations close June 8, 2026. Kai, Lami, yau na yi kewar girkin ki sosai.
Me gida. Ni ma na yi kewar naka. Ka tuna lokacin da nake da ciki kai ne kake dafa mana abinci?
Shi yasa nake son ki sake, don na ci gaba da miki girki.
A'a, jikina na buƙatar hutu. Akalla shekaru 3.
3 kuma, ai wata 6 makin murmure.
To ka fara, zan sauko zuwa shekaru 2 da wata 6.
Mu dai ce shekaru 2.
Amma ka tabbata ka cika alƙawari fa.
To shikenan na amince.
Tattaunawa tsakanin ma'aurata yana da muhimmanci. Mu tattauna.
Jolly Johnny akan titi ke magana. A yau za mu ga kyakkyawar sani da mutane suka yi wa Maggi Chicken Flavor. Na gaba, karanto harufan celery.
S-E-A-L-A-R-R-I-E. Celery.
Haba mutumina, ka ce kawai ka sauya harufan zuwa salary. To ga damar ƙarshe, karanto mana harufan turmeric.
T-U-R-M-E-R-I-C. Turmeric.
Kin yi daidai, ga kwali ɗaya na Maggi Chicken Flavor ki ɗauka.
Maggi Chicken Flavor tare da albasa, celery da kuma turmeric mai canza wasa na.
Invicta 98.9 FM.
DJ Virus. Country hard, now because you never hear correct music. Shake body, forget say you never pay your landlord rent. Any where you dey 9 p.m. My brother, make it counselor. No wait, make person tell you talk say Makosa Lingua either drop on top Invicta 98.9 FM by 9 p.m. with MCJ to the Blinks.
Trop intelligent pour être ici et trop con pour être ailleurs. Patrick Pancos, la voix qui caresse.
No wait, make them tell you your happiness na your handy day. Makosa Lingua na for everybody.
La vie bougie.